Thank you, Chairman. Thank you as well, Dr. Rowe. Mr. Secretary, thank you very much for being here. Dr. Stone, really appreciate it, finding this very informative, and really appreciate your obvious high level of knowledge and dedication to our veterans and the Veterans Administration. So thank you. I come from Pennsylvania, the 9th Congressional. We relatively rural area. We very fortunately, though, I think the best district in the country. We've got 85,000 veterans that I'm fortunate to have in the district. We are served by the Lebanon VA, which tends to rank pretty high, does very well. The Wilkes-Barre VA is right outside my district, but many constituents do go there, and they do a fine job as well. We do have Fort Indian Town Gap, so we have many military personnel and veterans from that within the district. The Tobiana Army Depot is right outside my district, so it's very much of a military area. Many military families are touched by the VA. The Lebanon VA has done a great job. It's really a center for innovation. It has many vets in there on a regular basis, even for social reasons, which is really nice. They've done an excellent job in really cultivating and maintaining strong community relationships, and that is something, frankly, that I strongly encourage for the local VAs to become part of the community, as businesses do and other hospitals, because it really works out for them. They bring in a lot of state and local officials, primarily the Lebanon VA, the VSOs and such, other non-governmental agencies. So they really do a nice job. The veterans there are very satisfied. I'd say very satisfied, as it ranks high with the healthcare services. Now, many do go to more local community doctors for special services, and closer to where they live. And just in response to the proposed 60-minute drive distance, is the VA planning to improve the space leasing process? Because I understand that can be a little cumbersome. So local VA facilities can increase their points of access, or is it the idea to contract for care throughout the community, or a combination of the two?
Thank you, sir. I want to say we were talking earlier about the projections and the movement of the veterans population through 2040. Pennsylvania is a constant in the top 10. So what you said is indicative of the entire state. You just hit on something that is part of the new way of looking at this. As Dr. Rowe has said, we're getting away from the construction of new hospitals. I mean, there have been some in the pipeline. We're getting care that's closer to home. This Congress has afforded us the opportunity to finally close the circle on family caregivers and their support. Leasing is important. I mentioned Fayetteville, North Carolina. 2 massive VA facilities in Fayetteville, 2,000 new veterans a month coming into the Fayetteville VA. The new facility is leased. I mean, it's so big that we have golf carts that bring in people from the parking lot. But by leasing it, our people can focus on the needs of the veterans, not cutting the grass and those kinds of daily things that make a building work. So that use mix has to be part of the future. And as Dr. Rowe has pointed out, the days, I'll say it, the days of us building a $4 billion hospital have to be a thing of the past.
We do feel, and I'm going to come back to the lifetime commitment we have to the American veteran, there are certain disease processes that are so complex. For instance, prostate cancer, one of the most common cancers in the American male, is unusually more aggressive in the American veteran, especially the Vietnam-era veteran. We therefore have entered into a relationship with the Prostate Cancer Foundation and the National Cancer Institute. in order to provide state-of-the-art germ cell testing as well as precision oncology to the 12,000 veterans that we diagnose with prostate cancer each year. So we certainly see ourselves buying certain care in the community because it's convenient or it's in a rural area, but those are transactions of health care. We think that the full understanding of the American veteran should remain with the veterans' health care system, and especially in areas like prostate cancer and other solid cancers are things that we ought to be in the center of.